I'm like, I don't know what that green dot means on her practical exam. I'm just going to go with it, right? I love it. Okay, so we plugged it in. Remember, we're not going to like make sure that this and it comes off, all that good stuff. So that would be the other thing from the practical. As soon as you got done with that patient, I would like to have seen you unplug this, put out the plugs underneath, and then take care of, go to your next treatment with them. Because then they go to get off, you go backwards, you trip over that cord. It's always good to have that unplugged. And then whoever's going to need it next in your clinic, usually it's busy and somebody else wants it, it's already set and ready for them. So it's a really quick thing. You clean off the sound head, you unplug it. Same with this. You just take your pads off and you unplug it when you're done with that so that it's not just sitting there. Okay, so I actually think this time when I do the practical, that will be something I will give you credit for or not if that's not done. Okay? That always helps us do it, right? We love credit. We love points. Okay, so then I turn it on. That's always kind of the big thing is where's the on-off button? A lot of times, isn't it working when you're nervous and your CI's looking at you and it's like, yeah. So they don't let them mess with you too much. This book is amazing. I don't know how many of you might have used it when you were doing the ultrasound, but it goes through the different parameters. So it'll do acute pain, which you'll be doing next week. We are going to go into the green section, I think. Blue section is muscle rehab. Okay? So it has a nice little cheat sheet of everything that happens. So when you're in a clinic, if you have something like this, it's really nice if it's a new machine and you're not familiar with it. It goes through and tells you how it's biphasic, or you can use Russian stem. It gives you high volt, which we're not going to go over today. Talks about biphasic, the waveform, right? And gives you all these different parameters that you can do. So it's kind of a nice little double check if you need it, if you don't have your chart with you. Okay? I would recommend, this is really nice to have. Most of my students took this out with them on clinic. They just laminated and put it in their notebook with them as a little cheat sheet for them to have to help them out. Okay, so now we're here. Like we already talked about, so for us, for electrical stem, you have IFC, pre-mod. We are not going to go over those today, okay? Then over here we have biphasic and Russian, and those are the two that we're going to focus on today for muscle re-ed and strengthening, all right? So the first thing I'm going to do is I'm going to hit biphasic. So let's say I'm going to do muscle re-education for the quadriceps muscle, just because it's easy to demonstrate. So if I'm going to do a duty cycle or an on-off cycle that's 1 to 5, how many minutes do you think I need for, say, 15 contractions? 15 minutes. So I'm going to move that up to 15 because I think you need at least 15 contractions to get something. The research shows that you usually need at least 15 contractions. That being said, there are patients who are going to fatigue after 3 or 4 contractions. So you're just going to have to build them up to that or give them a little longer rest time, okay, in between. So here it's going to default to channel 1 always, okay? And it'll always be the highlighted green button that's on. Okay, so right now it's saying it's channel 1. It gives us the time. Now I want to change to my frequency. So right now it's giving me a pulse rate of 50, which we know that's within our range of, what's our range? 35 to 80. So 35 to 80 for muscle re-ed and 35 to 50 for strengthening. Okay, so depending on our goal, it's within our range, and so it goes back to time if I sit around here and talk for too long. So we'll go back. Well, now it's not doing anything. It wants me to hook it up. Okay, fair enough. Who wants to be my patient? Who has a nice, good deal? Thank you very much. So maybe if you guys want to clear this table off so we could put Allison on here. I'd like to do a long sit. So we might have to pull it up. Can you pull that up to long sit for her?